Let's talk a little bit about transfer of care patients. Transfer of care patients is really a big category that encompasses three types of patients that we oftentimes deal with. Number one, patients who are currently in another program working towards surgery and want to decide to transfer their care to us. Number two, patients who have had surgery elsewhere and maybe you've been lost to follow-up. Maybe you just stopped following up with your previous surgeon and you really want to get back on track, use our dietitians, and get back into our program to have your blood work and your labs followed chronically. And then number three, patients who maybe have had surgery at any other institution but feel like because of the weight that they've regained or the problems they've developed, they may be a good candidate for a revision or a different surgery from what they've had previously. Let's talk about that first patient first. You've worked through a program, you've gotten a few months into it, and you've decided that you're just not comfortable with where you're at and you would like to transfer to our program to complete the process and lead up to surgery. We absolutely would welcome you, and most of the time we can take the workup that's been done there and expedite the process and not repeat anything unnecessary. Patient number two, you had surgery elsewhere, maybe 10 years ago, and you really haven't followed up with your bariatric surgeon in some time. You've been lost to follow-up. Maybe you've not really been following the rules like you needed to in the past. We would welcome you as well. We'll get you back into our program. We'll establish some ground rules to help you get back on track for success. Or maybe you just need us to help follow your labs that should be monitored for the rest of your life. We'll do those things too and give you access to all our dietitians, all our physician's assistants, and all our resources that we have, including our body composition and in-body scale. And then the third patient would be somebody who maybe had bariatric surgery elsewhere, doesn't matter where it was, and you feel like maybe you're not getting the results that you needed. Maybe you've not lost as much weight as you need to lose, or maybe that surgery led to some issues such as reflux or problems that aren't seen to getting better with medications by a family doctor. We will welcome you too. We can evaluate the surgery that you had and maybe recommend the type of revision that you need. We do everything from manage bands that have been placed by another surgeon and continue to use that band to your advantage. We remove bands for patients who no longer want them. We convert bands to sleeves. We can convert band patients to bypass patients. We can convert sleeves to bypass, and we can convert a sleeve to a single anastomosis duodenal switch. And there's other options as well. But we'll evaluate you and tell you if revision would help you and get you back on track, as well as all the long-term follow-up that would come along with that. We will always welcome patients here at Georgetown Bariatrics and Advanced Surgical Services who have had bariatric surgery elsewhere, who are just trying to get back on track. So reach out to us to help you get started on the next steps.